Namaskar दोस्तों, welcome to channel Toxicology on board. Today in this video we'll be discussing another important topic, that is selenium deficiency. So let's directly dive into the question. This question is taken from a ABT recertification. Question year is 2009. Which of the following disease is produced by selenium deficiency in labs and calves? So whenever we are reading about metals, no, you have to read two important things. One is deficiency of this metal will cause what type of toxicity. Excessive consumption of that particular metal will cause what type of toxicity, that you have to see. So one video with respect to selenium excess consumption, I have already made a video which will cause blind staggers or alkali disease. So I'll give you the link in the description. You please go back and read one question with respect to selenium excessive consumption causing blind staggers or alkali disease has been already mentioned, which was already appeared in the ABT recertification question paper. So please go and read that particular video. Now in this video we'll read about what is the deficiency of the selenium is going to cause, how it is going to impact lambs as well as calves. The right answer will be white muzzle disease. White muzzle disease is the disease which is caused because of the deficiency of this particular metal called selenium. Alkali disease is something, both alkali disease and option C, that is blind stagger, it is caused because of excessive selenium consumption. Okay, by the grazing animals, that is cattle. And microcytic anemia, hepatitis, why it is caused, we'll see the explanation which was given by the previous DABT students. So a myodegeneration, myo means muscle. Degeneration frequently develops in calves and lambs of dams. Dams means pregnant. Whenever rabbit pregnant will be there, no, it is called dams. That received selenium deficient feed. So whenever these kind of pregnant animals who are consuming the uh, grass or feed which is deficient in this particular metal ion, that is selenium, then they will be getting this myodegeneration during or before gestation. So there is a you can see pregnancy window, particularly during gestation period. If these animals, grazing animals, are consuming a fodder of they are taking the grass which is deficient of the selenium metal, then particularly the calves and the lambs which are born, they have white muzzle disease called myodegeneration. Next is, we'll discuss option D, that is microcytic anemia. Microcytic anemia, it is attributed with the copper deficiency. So which of the following metal will cause microcytic anemia means the answer uh, will be uh, copper. Okay. So another thing here, pause the video and try to make notes. You have to read about different types of anemia, like megaloblastic anemia, aplastic anemia, microcytic anemia or macrocytic anemia. So for different types of anemia, one or two questions you will get in the exam. So try to make a notes, make a list of types of anemia and what is the metal or anemia or the particular drug which is responsible for causing this type of anemia. Let's go back to next option, that is option A, that is alkali disease as well as blind stagger. Both are associated with selenium toxicity. In detail, you can go back and check this video. Hepatitis, something related to liver, inflammation of the liver. So it is caused particularly alcohol. When you consume ethanol in excess, it causes fatty liver or hepatitis. So solvents or plant toxins are the one which are associated with hepatitis, that is with liver toxicity. But selenium, the target organ is not liver. Okay. So now we'll little bit in detail, one or two slides will try to understand what is white muzzle disease. Okay. So because about selenium toxicity, much of the information is not given in the Clayson textbook also, but it is listed under chapter 23, toxic effects of metals, Clayson textbook, which is a part of ABT syllabus. No, in the textbook is mentioned. So selenium falls under essential metals with potential for toxicity. So selenium is very useful, but at the same time some either deficiency or excess of selenium will cause some kind of toxicity. That's why it falls under essential metals with potential for toxicity. So this particular type, this slide I have prepared so that we can categorize the chemicals based on toxic metals. So you will get in exam one or question with respect to metal toxicity. So pause here, try to remember what are the major toxic metals, what are the essential metals with potential for toxicity, metals related to medical therapy, okay, and minor toxic metals. Okay. So next we'll dive directly into white muscle disease. White muscle disease, which is a nutritional myopathy. Myo means something related to muscle. A degenerative muscle condition affecting animals, primarily the young, as we have seen, no, particularly pregnant cows who are consuming that fodder which is deficient of selenium. Particularly, they are exposed during gestation period. So there, the babies which are formed, baby calves or lambs which are formed, no, particularly that's why primarily young and rapidly growing livestock like calves, lambs, and foals. This white muscle disease is caused by dietary deficiency of selenium, vitamin E, sometimes both. Whenever the diet is deficient of selenium or vitamin E, you will get this white muscle disease, which leads to oxidative damage and the breakdown of the muscle fibers. So pause here. Again, try to remember when is the muscle wasting is happening. When is the muscle fibers are undergoing degeneration. Another drug which are associated with muscle fiber or muscle wasting. So one is thing that we will come across statin drugs. Statin drugs are one which are responsible for causing myalgia, I guess. So read about that thing also. One of the it's a hallmark for the statin toxicity. Okay, let's come back to the topic selenium. The disease is primarily falls into two forms, that is cardiac form and skeletal form. So it is going to affect two important organs. One is heart, another is muscle. Okay, how it is affecting the heart? Affects the heart, leading to sudden heart failure or respiratory distress, because there is a oxidative damage is also there. Reactive oxygen species are there. So it is going to, and heart and brain are the only organs which need highest amount of oxygen. Uh, so probably that might be the reason it is causing respiratory distress or heart failure. So if you look into a gross necropsy of a of open heart, you can see white color muscle tissue. You can see here. This is what is called. The name comes for the disease, white muscle disease. Second one is skeletal form. How it is going to affect muscles used for movement. So these animals who want these calves, they are unable to walk. They show staggering or gait, resulting in stiffness, an arched back, inability to rise, or a staggering gait. Okay, the condition gets its name from the pale chalk whitish streak or patches. This one I told you, know, of necrosis left in the heart and skeletal muscles, which can be observed during whenever you do post-mortem examination. Cut open the animal, you can see this kind of hallmark. This is the identification for selenium deficiency. Next, why it happens? Why means we understood because of the deficiency in the diet which these cattle animals are consuming. So again, we'll try to read it. Selenium and vitamin E act as essential antioxidants. Vitamin E, another name is tocopherol, that protects muscle cells from oxidative stress. So oxidative stress, we know that it will release reactive oxygen species or reactive nitrogen species, and there are a series of steps will be there, because of which cell either undergoes necrosis or apoptosis. Okay, deficiency commonly occurs because soil depletion. So the plants which in I mean natural grazing animals, if that particular land area is there, their grass is there, and in that soil is deficient of this particular then the plant itself will not have the selenium deficiency will be there. So the forages and the grain the animal eat are grown in soils that are naturally low in selenium. So there will be geographically some areas are there which are deficient of this selenium metal. Next is feed storage. Vitamin E levels naturally degrade because vitamin E is tocopherol, antioxidant, in stored or dried feed over time, making fresh pasture and the best source. So certain times what is happening, whatever these cattle animals are there, no, they will be feed this kind of chow or what is it, feed will be for. But this whatever the artificially made feed will be, the feed diet will be there, no, it contains some selenium content. But over a period of time, in the shelf life, that because of this degradation nature of this vitamin E, the selenium levels in the diet, the stored diet might come down, because of which uh, animals will be deprived of this selenium. Next is maternal transfer. Mother is consuming. There is a cow, there is a buffalo who is or cattle or sheep who is pregnant. She is consuming the food or the feed diet. That diet is deficient of selenium, and through that maternal transfer, because you have to understand, placenta is not the complete 100% it is not 100% barrier. Lot of fluids, what of diet might pass through the placental barrier and reach the baby in the stomach. So it will affect the particularly when it is exposed during gestation, this baby calves or cattle will be affected because of this placental transfer, maternal transfer. If pregnant dams do not receive enough of these nutrients during gestation, their offspring are born which are highly susceptible to this kind of white muzzle disease. Okay, so now we'll see what is the diagnosis, how we are going to diagnose and how we are going to treat this particular white muzzle disease. Because since we are talking about this disease with respect to cattle, no, veterinarians typically diagnose white muzzle disease by evaluating animal's dietary history. They will go and check what was she consuming before and what is a particular pasture area where these animals were grazing. Checking for the elevated muscle enzymes. So in the muscle, what you are going to measure? Two biomarkers. One is creatine kinase, another is AST in the blood, and testing all blood selenium levels. You can take the blood samples, check the selenium levels in the blood sample, then you can identify whether there is a deficiency or excess of selenium is there. Next, how you are going to treat these animals? Mild to moderately affected animals can often be successfully treated with targeted injection of selenium and vitamin E. Since now they cannot consume it through diet, so immediate what you can do, you can give selenium injections or vitamin E injections. Okay. So how you are going to prevent? Prevention is far more better than diagnosis and than treatment. No, how you are going to initially only prevent this for this most effective way is to manage the disease is through proactive dietary management. So you have to constantly check what kind of and a lot of dietary analysis also timely every month. No, you have to analyze the diet which you are giving to these cattle animals. You get certificates from the labs which will give you what are the percentage of the components present in that particular diet. Okay, so dietary management rather than relying on the treatments, provide well balanced mineral and salt supplements tailored to your local soil conditions, because you have to also check if you are naturally allowing the animals to pasture in that but grazing animals, then you have to check the soil content also, the selenium content in the soil. Ensure pregnant females receive proper vitamin and mineral supplementation in the final months, because every animal will have its pregnancy window differently. So cattle animals, so during the last periods of her pregnancy, you have to make sure that the particular cattle animal is receiving enough amount of vitamin as well as mineral supplements. Final month of pregnancy to pass immunity to the young, because very important maternal transfer immunity to the cattle or the or the or the babies in the stomach is very important. Okay, so that was about the white muzzle disease. Now we'll see some of the questions which we are discussing, because first we have discussed with respect to DABT, that is recertification question paper. Now we'll discuss some questions which were mentioned in American Academy of Chemical Sciences, Clinical Sciences. Why we are discussing AACT is you have to understand DABT question is framed by the American scientists, and particularly those people are from the most of them will be from the FDA related questions will be there. So some of the questions from the American Academy also same topics might be there. Some of the faculty might be there. So we are trying to discuss in some of our videos some questions from American Academy of Clinical Sciences only. That is called question of the day, so that we can learn the concepts with related to same topic. So first question is acute and chronic poisoning with selenium or selenium containing products has been associated with strong garlic like odor. So there is one thing called, in case of analytical toxicology also, forensic toxicology also, in order to identify the poison or what is physicians or the emergency department physicians have to identify it, no, you have to smell that particular chemical. So when by based on the smell of the breath or smell of the particular chemical which is exposed, you can identify. So whenever you have a garlic like smell, you can assume that okay, selenium might be the one of the metal which might be the reason for this toxicity. Okay, so you have a garlic like odor of the breath, and some cases what is the presumed cause of the odor. So now you have to understand why you are having garlic like odor. Okay, the strong garlic like odor usually present in both acute toxicity as well as chronic toxicity attributed to the volatile metabolite dimethylselenide. Now, I would request you to pause here and read about biomagnification, bioconcentration. Okay, these are the things. No, for example, in the case of methyl mercury is there, organic mercury is there. When it goes through the food chain, no, it undergoes biomagnification or bioamplification. So there is another two more metals. I think it is arsine as well as selenide. So in the case of dimethyl selenide also, it falls under biomagnification, bioconcentration only. So try to integrate and read. I will give you the link in the description where I have discussed about mercury, methyl mercury toxicity. In that, one of the question came in ABT recertification about dimethylselenide also. So try to read it. Here in this case, what is happening? A patient is there who is exposed to selenium toxicity, and that patient came to the emergency department, and that particular patient is showing garlic like odor. Now the physician has to identify what is that chemical. Then he will assume that okay, this might be a selenium, and the garlic like odor is because of the formation of this particular metabolite. What is that volatile metabolite? Dimethyl selenide, because the smell is coming from his breath, from his or um, from his breath. Okay, respiration, I mean to say. Okay, now we'll see what is selenosis. Another thing, like any metal, if you see, for example, in the case of beryllium, it is called beryliosis. So like that, metal and its associated diseases will be there. So similarly, with respect to selenium, whenever there is a toxicity with respect to selenium, that particular disease is called selenosis. So we'll read one concept with respect to selenosis also. What is selenosis? And symptoms are consistent with the diagnosis of selenosis. So what are the symptoms once a person is exposed to this particular selenium excess exposure? What are the symptoms that we have to see? So we'll see the answer. Selenium is the term sometimes used to describe the constellation of symptoms. So certain times what happens, but you have to understand this concept also. What is disease? What is disorder? What is the when you have a cluster of symptoms, no, then it is called disorder. Okay, so here also in the case of selenium also, there is not single symptom. You have a constellation of symptoms, a cluster of symptoms. Okay, a group of symptoms associated with the selenium toxicity. So selenosis may include alopecia. So one question you will get in the exam, there is a certain patient who is exposed to certain metal and is showing hair fall. So you have to identify the option. For example, they'll give you arsenic, lead, mercury, something like that. One of the option will be selenium. Answer will be selenium. So metal which is associated with alopecia or hair fall, then you have to consider the answer is selenium. And also you have to remember, when there is a particular like forensic case or analytical case in that particular crime scene, if there is hair is there, then you can understand that selenium is responsible for that particular kind of poisoning. So hair fall, that is alopecia, then brittleness of the hair, breakage of the hair, nail abnormalities. So one question with respect to nails also you have to remember, that is Bartolian lines, knee lines, okay, white color line or pink color line. So like that, by looking at the nail clubbing of nails, so these are the various indications how you can identify a person is exposed to certain kind of poison. So in the case of selenium also, you can see that there will be nail abnormalities. I'll show you the picture in the next slide. And skin rashes also is there, and gastrointestinal symptoms. Okay, so hallmarks you have to remember alopecia, and you have to remember about nail abnormalities. Okay, in addition, garlic breath odor, abnormal levels or mental stress may be noted. So one thing you have to remember, I think metal fume fever is there, no? One question with respect to metal fume fever also you'll get in exam. That is also associated. One of the metal is selenium also. In geographical areas where high soil selenium concentration occurs, alopecia and nail dystrophy are the most commonly reported findings related to selenium. Okay, so we'll see one diagram. So this is what I was talking about, the how the nails are affected with the exposure to selenium. So we'll see another question. So in 2000, year 2008, there was an outbreak of selenium poisoning. What exactly has happened is that, see, lot of dietary supplements are taken by this uh, gym workers or like that. So if that particular dietary composition, if it is deficiency of this sorry excess of the selenium is there, then some symptoms were there. So there was an outbreak in 2008. Selenium poisoning was reported in 200 individuals in 10 states. What has exactly happened in in this case is, the people consumed a liquid dietary supplement containing 200 times the label concentration of selenium. So whatever the dietary supplements which you take, no, components and the percentage will be given. There was one batch which was having 200 times more than what was mentioned on the label of that particular dietary supplement. So median estimated dose of selenium was 41,749 microgram per day, which is nothing but 41.7 mg. Recommended dietary allowance is only 55. Okay, and here they were consuming average. I'm saying it is 41.74, which is still less only than the no. No. No, which is too much high. I am talking in terms of mg. It is 55 microgram. Here they are consuming around 41,749 microgram, which is too more high than the dietary allowance what they have mentioned. So what are the most frequently reported symptoms associated with the outbreak? So you can go back and check in the website in the Google. Ki what is this 2008 outbreak? But here we'll restrict only what were the symptoms. So the most frequently reported symptoms associated with this particular outbreak were diarrhea, fatigue, hair loss, joint pain, nail discoloration or brittleness, and nausea. Symptoms persisted 90 days. Even after exposure of this particular dietary supplement, after 90 days or longer, nail discoloration, loss, fatigue, hair loss. Okay, after 3 months also still the patient still showed these kind of symptoms. So next another question we'll see which of the following is the most silent finding in the case of acute selenium salt overdose. The right answer is hypotension. So what happens in the case of this? There is a respiratory distress which we have already seen. Hypotension is thought to be caused by acute toxic cardiomyopathy, decreased peripheral resistance. Hair loss and nail changes are associated with chronic overdose. Diarrhea and not constipation occur in the case of acute as well as chronic overdoses. So two slides I have discussed with respect to PK Gupta. So people you can also read PK Gupta also to understand in very simplified language. Very good books are written by this particular author. So first we'll see what are the different. So whenever we are reading about metal, we have to see whichever oxidation form states that particular is there. For example, in the case of vanadium, pentoxide or chromium, +6 state is more toxic or +3 state is more toxic. So like that you have to read about oxidation states also. So in the case of selenium one we will see. So selenium occurs in nature, biological systems as selenate. Here I've given the figure, you can go pause the video and read. Selenite that is Sc+4, selenite that is Sc+2 and elemental that is Se0. Okay, so different forms of selenium. Next, why selenium toxicity more commonly seen in the case of arid and semi-arid climatic zones? I told you, based on the geographical area, if the soil is deficient, then the plants which are grown in that particular deficient soil and those plants are consumed by the cattle animals. Okay, in arid and semi-arid climate zones, due to less rainfall, selenium is not leached from the top layer of the soil. Hence, chances of selenium accumulation are more common. Okay, so very beautiful point they are saying. Due to less rainfall, selenium is unable to reach to the deeper layers, so it is being on the topmost layer of the soil. So plants will be in the plant. Accumulation takes place, and those plants which are consumed by the cattle animals, they will have selenium toxicity. Why cracked and overgrown hooves are seen in the case of selenium poisoning? So this is also very important question they will ask you. Selenium replaces sulfur in the case of sulfur containing amino acids such as cysteine and methionine. What is happening in the case of metabolism is that naturally these are two amino acids, that is cysteine and methionine, but the structural similarity is similar to the selenium. So whenever there is selenium you consume, what happens? Selenium in your body, it is going to replace these two amino acids, that is cysteine and methionine. Okay, because of which you will have this hooves. Okay, which leads to structural abnormalities in the case of proteins. However, overgrown and cracked hooves are seen. And okay, next, what is selenium toxicity? A non-metal functions as both toxic and an essential element. As I told you, excess will cause toxic, and deficiency will also cause. We need it. It is an essential element. We need it, but deficiency will also have some symptoms. That is white muscle disease in the case of cattle. Poisoning occurs when animals ingest excessive amount of selenium, that is blindness and staggering. Then cracked hooves or lameness also you can see. Subacute will cause blind staggers caused by accumulation of around 2.5 ppm of selenium in dry matter content. So this is the thing. Next, one important last question we'll see. Deficiency of this, which of the element, particularly in the case of sow, that fodder will cattle fodder will be predisposes baby pigs to toxicosis by injectable iron preparation. So whenever the fodder is deficient of this particular metal, then you have to give injections. What injections means? Iron injections you have to give. So what the answer, right answer will be selenium. So selenium deficiency, pigs are there that consuming certain cattle fodder, that is not that is deficiency of selenium. So in that case, what you have to give to these particular pigs, you have to give it selenium. Okay, next, which of the following nutrients can counteract toxicity of organic mercurial? Right answer is vitamin E and selenium. In the first slide itself we have seen, whenever there is a deficiency of the vitamin E or selenium, plus in certain cases both, then you will be having this particular type of white muscle disease you will be getting. Another important thing here you have to remember is that what is happening is, no, selenium is acting as a antagonist. So this particular concept also you have to read. So selenium, it acts as an antagonist. As a result, methyl mercury demethylation to make mercury, it is going to stop. So that is the concept here you have to remember. Okay. So thank you so much. Be curious. Read about metals. Metal toxicity is a very, very important topic. Various metals they will ask. They'll ask you about mercury. They'll ask you about arsenic or lead or magnesium, manganese, zinc. Zinc also nowadays lot of questions they are asking. Okay, so one video with respect to selenium toxicity, blind stagger, alkali disease has already been uploaded. I will give you the description in the link. Okay, thank you so much. Be curious. For any questions, you can always write a mail to arya.priyanka18@gmail.com. All the best for your exam.